Good evening, and thanks for joining us today in this webinar about PLAB 2 UKMLA. First of all, I'm going to introduce myself very quickly. My name is Ibrahim Hamami. I'm a GP. Some people call it a family physician. Others will call me primary care consultant, depends where you are, which country, which continent, etc. I've been working in the UK for the last 30 plus years, and I'm still working as a GP, which is a specialty and so on here in this country. I used to be like you. I came to this country. I did the PLAB test in the 1990s, early 1990s. Started working, and as the time passes by, I became a PLAB examiner for 4 years. And here I am now training and teaching about PLAB 2, UKMLA. It will be a very quick presentation just to take you through. And mind you, some of you have finished the medical school, just finished the medical school, so they don't know anything about the PLAB probably. Others just passed the PLAB 1 test. Some of you tried PLAB 2 and they want to improve their chances of passing next time because they didn't make it the first time, and so on. So some of the information might sound familiar or you know about it, but it's just to cater for everyone at every level. There will be a lot of tips and advices, and at the end we're going to open the floor for any questions to answer them if we can. And hopefully you'll find this webinar useful for what you're looking for. PLAB 2 UKMLA is the same. At the moment, the GMC has said that they will keep the name for the PLAB 2 test as it is compliant with the UKMLA. They're not changing anything for now. We'll come to this later. Congratulations to those who passed the PLAB 1. This is a big step towards your career in the UK. PLAB 2 awaits you. Keep going strong. Okay, it's the first step, the second step, and then finding a job, etc. A bit about the Checkers Academy. We offer expert training for medical professionals at every stage of their career. PLAB 2 course is one of the things we offer. We offer a lot of other things which you might find useful for your career. You might even check it now. Life in the UK, if you want to rent a property, how much does it cost to live in the UK, how to open a bank account, about transport, about restaurants, schools for children, visa applications, etc. I mean, we have tailored courses for these things and much, much more, like LGBTQ, A++. It's a big issue here. Whatever you need, I mean, I would advise you go to checkersacademy.co.uk, look for careers courses, and you'll find a lot of important information for you. Why choosing us in a very quick presentation before going to the PLAB 2? We offer affordable packages, expert providers. Myself, I'm an ex-PLAB examiner, and my colleagues are all practicing GPs and consultant and doctors in the UK. We have small class sizes, so there's some sort of personalized attention, one-to-one advice and feedback. There is a chance of gaining experience in the form of clinical attachment. We provide some sort of clinical attachment, not a lot of places, but we can tailor that in local surgeries, local practices, GP practices around Greater Manchester area, Northern England. Affordable training in terms of rates, and we also provide accommodation for those who need accommodation in different areas around the northwest of England. Very easily commuted to the course place and for the GMC for the PLAB test itself. It's the final step towards your career, the PLAB 2 examination. And we help by hands-on clinical skills training. We look after, I mean, what do you actually need, the weaknesses, where you need more attention, more help, more assistance, and we provide that. Now, the UKMLA, as you probably know, is the new format. It has started in the medical schools in England. Each medical school call it different names, but it is unified now. So every doctor working in this country should go through the same test, whether it is PLAB 2 or UKMLA. It's the same format for home students and for those coming from overseas or international medical graduates. Two parts, still two parts, AKT and the other part, which is CPSA. I mean, the details are on the GMC website, but a lot of questions are around, what if I've passed PLAB 1 and PLAB 2? Do I need to take it again? No. You've passed it, that's it, you can get your registration. If you passed one part like PLAB 1 and you haven't done PLAB 2, you continue as normal for now. When UKMLA becomes the actual test for people coming from overseas, if you've passed PLAB 1, this will be equivalent to AKT, and you have to take the CPSA instead of PLAB 2. However, I repeat myself, at the moment, PLAB 2 is still the exam to get registration in the UK for overseas students. Nothing has changed so far for that. It is now, PLAB 2 now is UKMLA compliant, and it still continues with the same name, with the same format. So this table in quick, I mean, the course will explain more about this when you take the course, if you do, and how to integrate between the PLAB 2 and UKMLA when it comes into force. Now, talking about the different stations, the format of PLAB 2. PLAB 2 is 16 stations with 2 rest stations. That means when you go to the GMC building, this is the only place that where the PLAB 2 test is being held. It's in Manchester, and there's no other place for it. There are 2 buildings, both are GMC controlled or run, and you go through a cycle. Okay, the cycle is 18 stations, 16 clinical stations or scenarios, OSCEs, and 2 rest stations. Now, the way it works, each station is 8 minutes. Before you enter the station, you stand in front of the door there. There's like a small piece of paper with some instructions. You have 90 seconds, a minute and a half to read the instructions, look at them, and then formulate some sort of approach for the case, because there are different cases, different approaches for the cases. So you have a minute and a half to put your thoughts together, think about how you're going to deal with this problem, and then a voice will tell you, please enter the room. You enter the room, you have 8 minutes. After 6 minutes, there will be a reminder, only 2 minutes are left. So basically, you have to try to work yourself around this sort of time scale, time management. There are 2 rest stations to take your breath, to relax a bit, and continue. The whole exam takes about 3 hours and 10 minutes from the beginning to the end. You're not allowed to take anything with you to the exam. No phones, no mobile phones, no nothing, no equipment at all. You'll be provided with a BNF copy in every station, clinical station, okay? You have everything you need for the case you are dealing with, okay? Now, there are different types of stations, okay? Not one type, different types, different styles. What do you need to know about them? I'm going to go through some of the stations. I mean, having said that, the GMC keeps changing and adding new stations whenever needed. First of all, the history taking stations, plus minus examination. This is the classical one. Basically, you go there, there's a patient with a presentation, you ask them, take history, do the examination if you need to do examination, and come up with a management plan within the 8 minutes. However, my advice is to try to finish everything within 6 minutes, so you don't panic when it says only 2 minutes are left and you try to finish everything within 2 minutes. So do whatever you need to do in 6 minutes and then wrap it up in the last 2 minutes. The other type of stations are counseling stations. This could be medical counseling, like about lifestyle changes, about any condition, anything like that. Could be surgical procedures counseling. Someone's going through endoscopy, you have to explain the procedure for them. Or colleagues counseling, whether it is a teaching training style. I mean, you're talking about someone how to read ECGs or whatever, or training them, or counseling them about something that happened to them. The third type of stations is the ethical type stations. So it's about confidentiality, consent, candor, capacity. And I do understand that most candidates find these stations are difficult. They find them difficult because unless you are aware of the current guidelines, policies, and laws in the UK for confidentiality, consent, capacity, etc., you will struggle. And this is part of what we do. I mean, prepare you for these types of stations, the difficult ones, which are basically and solely based on UK practices. There are, of course, combined stations which can be counseling, medical, and ethical at the same time, different scenarios. Now, the other stations, and there's no exam without them, is the mannequins, which could be 1, 2, 3 stations, whatever. And there are 2 types of mannequins here. There are the still ones, which you do the examination over them. The instructions will tell you exactly what you need to do. And when you're doing that, because there's no role player in the room, we'll get to that in a minute, Okay, you have to keep talking while you're doing it. I'm doing this, I'm doing that, I'm examining this, I'm examining that. So the examiner, the assessor, can understand and can follow what you're doing. The other type of the mannequins is the high fidelity, whatever, the Simon. And again, most candidates find this one of the difficult stations, although if you prepare very well for it, I mean, people hardly fail this station, despite, I mean, all the anxiety around them. And the Simon is basically like a whole body mannequin, but it talks and it acts and it's connected to a monitor. So if you do something wrong, the pulse will go mad, the pressure will drop, there will be dyspnea, and if you do something right, the patient will be more relaxed. Okay, all the observations will be normal again. And of course, there's an examiner observing what you're doing. The other type of stations there is the prescribing or prescription stations. And you go there, there are instructions, for example, a culture and sensitivity result is there, and you need to prescribe something to a patient in a ward, and you have to write it in the drug chart. You have to be careful because sometimes there's a trick. You need to stop one of the other medications, there's an interaction with one another medications, etc. So it's not just writing it in the chart, but also knowing what type of medications, interactions, contraindications depends on the patient's condition. There's no interaction with anyone in these prescribing stations. You just yourself with a chart and the instructions. The examiner will be there watching you, but there's no interaction. Other stations, practical procedures, IV line, catheterization, male or female, etc. And again, you have to carry on talking while you're doing the examination so the assessor can decide if you're doing it correctly or not. One of the other styles of the stations is interpreting data, ECGs, for example. So you have an ECG, you have to interpret that. And finally, communication, which could be communication stations, which could be the counseling, one of them, or the ethical, but also different types of communications, IPS. You talk to a relative of the patient, an angry relative, angry patient. Someone has made a mistake in the hospital, given the wrong medication. You have to explain yourself, etc. So again, part of what you do in the course is to prepare you for these difficult scenarios, difficult situations, and how to deal with them. Right. Again, this is the structure of it, but how the PLAB 2 exam is marked. Now, there are 3 domains which the examiner look at when you go into the room within the 8 minutes you are in. The first one is data gathering, which is basically history taking. And the key thing, if there are any red flags, you have to pick them up. It's okay to miss something. It's okay not to get a diagnosis, but you shouldn't miss the red flags because this will affect your management plan. You have to discuss the concerns, psychological history, examination if there's a need for one. Now, certain stations, I mean, with the history taking, if you miss something, you shouldn't fail unless it is an important one. For example, if someone comes with a history of urethral discharge, a male with urethral discharge, asking about sexual behavior or sexual orientation or visits to areas known to have prostitution, it's almost a must because this will direct you towards how you're going to ask, how you're going to manage. So each case, you have to look at it differently. And then the other domain is the management domain. So you've taken the history, you do the examination. Sometimes they tell you the examination is normal, or the examinations show 1, 2, 3. You don't have to examine the patient directly, but there's instructions about that. Or there's a mannequin to examine. The management, basically, you've identified the problem, you formulated some sort of diagnosis in your mind. You actually explore the patient's ideas, concerns, and expectations, eyes. Okay. Now you talk about how you're going to approach that. Could be an investigation, could be a medication, could be admission. So all the treatment investigation options. The key thing in this domain is to share your management plan with the role player, which is the patient, basically. And you keep checking that they understand what you are saying. Are you following me? Do you know what I mean by that? Do you need any further explanation? I mean, again, in the course, we will guide you about this. But you have to share it with the patient. And at the end, it's a safety netting. If you're sending the patient home with medication, you have to give them instructions. If this happens, you call us again. If this happens, you go to A&E, etc. Deterioration of symptoms, new symptoms, whatever. Now, the shared management is a key factor in the third domain, which is the interpersonal skills. Because remember, communication, IPS, interpersonal skills, is a two-way conversation. It's a two-way assessment. It's not just you talking. You're not going to be assessed by how you're talking or how perfect or brilliant your English accent is, but it's the way you interact with the patient. So shared management will allow you to show that you can interact with the patients, you are sympathetic, empathetic, whatever is needed. You check that the patient understands what you're telling them, and this shows your verbal and non-verbal cues from the patient and from yourself, how sensitive you are, how good in passing the information there. And of course, the language you use, no jargons, no medical jargons. You don't tell them what you're going to do to have endoscopy. They might not know what endoscopy is or whatever. So you have to explain in a language that a candidate or the patient can understand. And again, once again, the course will guide you through this if you join our course. Now, there are very common mistakes that people make during the case. I mean, whenever they're having a case to deal with. Uh, most people, most candidates complain about the time management. I have to do everything in 8 minutes. There's a bill or a reminder after 6 minutes. I do panic after the 6 minutes when they say it's only 2 minutes. I haven't finished history taking, and now I have to do the examination, the management, the safety netting, everything in 2 minutes. There isn't enough time. It's true. This is a skill. Time management is a skill. You have to learn. You have to practice and keep practice. Some people will bring like a stopwatch, they put it in front of them, and they practice on a 6 minutes, not 8 minutes. So they have plenty of time when they master how to deal with the time management. The other mistake that people do is being over scripted. Now, again, this is one thing about being scripted versus not scripted. Scripts can help, there's no doubt about them, but if you are over scripted, you can miss a lot of things. You can miss non-verbal cues. It would be a one direction conversation. It's almost like blindfolded, you go there. So basically becomes a doctor center instead of patient center, etc. Medical jargon, we commented on that quickly, touched on it quickly. You have to speak, you don't have to show off that you are a super duper doc, and I'm using terms like to show that I know my medicine. It's not, nobody's going to judge you on that. What you need to do is to show that you can communicate with the patient, you can explain to them, and they can understand you. So use the words, the techniques, the terms, terminology, etc., that patients understand. Now, the other way about the jargon, there's also the different accents, different words that patients use in the UK, and you have to familiarize yourself with those. I mean, no one's going to tell you I'm going to urinate, or when I urinate, I have like a burning sensation. There are different ways of explaining that. When I spend a penny, when I pee, when I piss, when I pass water. So there are different ways of expressing that. No one's going to tell you my abdomen is hurting me. No one uses the word abdomen. It's my tummy, for example. So, and again, if you go to the career courses on the checkersacademy.co.uk, there are different courses about these things, as mentioned before, including a course called Lost in Translation. I mean, both how the patients, express themselves in the UK. And this helps a lot in understanding the candidates, because part of the exam, because there are young people, old people, bringing people from all over the country, and accents can differ from one region to another. Some of them are really difficult. The other mistake is being robotic. So it's like, same tone, as if you're just reciting something. Okay, you just know it by heart and you're saying it. So you know what the problem is? You take history examination. Oh, okay, this is a chest infection. And because you know chest infection, you're a doctor, you start bubbling and mumbling and just continues talking the same tone, non-stop. So there's no communication, no interaction. The patient's just sitting there listening to you. It's a one-way direction. It doesn't help at all. This is one of the main mistakes. It doesn't show that you know your subject. Okay, you know about chest infection, you are clever, you are saying it all, but you are not following what you're supposed to follow. One of the main, not mistakes, but problems that people face is going blank, either because of stress, okay, because some of the stations can be challenging. And the instructions for the candidates will be, if the patients don't offer you that, or they say they're going to discharge you from the hospital, for example, resist, try to show some anger or anxiety. And people, when they're faced with that, they think, oh, I've done something wrong, I've alienated the candidate, or I've made them angry, and you start thinking about other things, distracted, get stressed, and you go blank. Or you can go blank because you don't know what's going on, you don't know what the condition is. You took the history, you took examination, and you have no clue what's going on. Then again, this shouldn't stop you if you follow the approach for each case, and if you follow what the examiner is assessing you on. If you don't reach a diagnosis, you're not going to fail as far as you do things correctly and you haven't missed the red flags. Okay? You carry on. If you feel that any of these mistakes they have affected you one or more in one of the stations, when you leave the room and you go to the next room, next station, with the instructions in front of you with 20 seconds, don't think about the previous station. Carry on non-stop, carry on with the next one. Leave the station you had this one of the mistakes or had problems with it, and carry on with another one. And remember, you are not a student, you are a doctor, okay? So you have to deal with stress, you have to deal with problems, you have to deal with anxiety, anger, difficulty, okay? And be professional and move to the next one. Now, tips about how can you improve your chances for passing from first time if possible. First of all, prepare, prepare, prepare. Now people ask, how do I prepare? Preparation has different ways, not just studying textbooks, medical textbooks. I mean, you are coming to work in the UK when you pass the PLAB 2. So you have to look at the guidelines, practices, and updates from the GMC, from the UK in general, nice guidelines, etc. So you know how this country functions. There are certain things that they don't exist from wherever you come from. I mean, for example, the type of support you get at home here, for example. I mean, Macmillan nurses, social services. In hospitals, you have PALS, which is the patient's assessment. If you have a problem in the hospital, you have to familiarize yourself with these things and study them. And of course, in our course, we guide you through these things. Practice, practice, practice. There's no explanation there. You have to keep practicing. Practicing the time, okay, with a stopwatch, practicing with colleagues, practicing groups, practicing hands-on in courses, academies, etc. And focus. And to focus, it means that everything has to be relevant. So when you are dealing with a station there, be relevant. If it is like clearly a case about suicide, young patient trying to slice her wrists, okay? You don't have to ask about in details, the history in details. Of course, you have to touch on everything. You have to correctly, but I mean, going through bowel movements and diet habits, etc., is going to eat a lot of your time, and you're not going to ask the right questions there. So you touch base on most of things, but be focused and relevant to the case in front of you. The other issue with the tips, scripted versus non-scripted. Learn about scripts, but don't overdo it, okay? Otherwise, you will miss a lot of things, the nonverbal clues and the patient's reactions, the patient's emotions, you miss that. Again, IPS, and when we talk about IPS, review your style, review how to deal with this, communication skills. Make sure you understand how to deal with different difficult scenarios. There are at least 20 difficult scenarios, 20 difficult stations. You have to be prepared for them, because if you don't know how to deal with them, you're in trouble. Build up your confidence, okay? Again, through practice with your colleagues, with your friends, with groups, listen to other people, studying more, familiarize yourself with different scenarios. Time management, we spoke about it. And the last thing, which is very important, be yourself. Again, and I repeat that, you are a doctor. You have done it before and you can do it again. Okay, you have dealt with patients before and you know how to deal with them. This is no exception, it's the same. You are dealing with a patient. Now, just a final word, personal word about that. Okay. Is it difficult? The PLAB test, is it difficult? It could be difficult. Right. So a final word of advice, personal advice. Okay. The PLAB journey can feel daunting, but you have been on journeys like this before, haven't you? All of us have been. You made it through the medical school, correct? You have treated patients, yes. You have already proven yourself. Now it's time to do it again, this time for your future in the UK. You have done it before, you can do it again. Remember, for the third time I'm saying, you are a doctor. You're not a student. You bring experience, skills, and dedication. Do it. If others have done it before you and passed the test, you can too. You can do it again. This isn't about luck, by the way. It's about preparation. So prepare, practice, and be ready. I'm not trying to sugarcoat anything or patronize you, just the support you actually need. This is what we are offering as an academy. I personally was in your shoes 30 years ago. I was a PLAB candidate. And by the way, I didn't pass the first time. I was uncertain about what's next, what to do after that. Then, decades later, not a year or two, I became a PLAB examiner. So success is possible. I'm not better than you. You can do better. If you prepare, practice, and do it correctly, you can achieve what you want. And again, the exam can be hard, not easy, but it is possible. So prepare, prepare, prepare. Then practice, practice, practice. And when you feel like you're giving up, don't. Because the goal is not just to pass, but to pass the first time if possible. Even if you don't pass the first time, don't give up. We are here to help every step of the way. So remember, PLAB is not the end, it's just the beginning. Join us, let us make your journey together, and hopefully you can pass the first time and become a successful doctor in the UK. Now, I will stop here, and if there are any questions, please write them on the chat there, and we'll try to answer them as much as we can. Probably we'll give another 15 minutes or so to answer questions. And do visit the website, look at the careers, look at the PLAB courses, look at the packages, see what we do. And if you are happy with what you do or you need more information about it, contact us. And we hope to see you in our next course very soon. I mean, one of the most common questions we get, I mean, do we provide accommodation? Yes, accommodation can be provided if requested. There's I mean, different person deals with that, but you can always inquire about that and we can direct you. Very affordable accommodation, nice one. Thank you, Leon. Yeah, the academy is located in Greater Manchester. We have another, I mean, branch or division in Blackpool, and accommodation will be mainly there and in other areas. And the actual address of the academy is 2 stops from the GMC. So when there are practical sessions, you'll be just 10 to 15 minutes away from where the exam takes place by train. For PLAB 2 cases, how can we be more confident? Again, practice, practice, practice. Probably join a group, look at previous exams, and join the course. I have just... Yes, Meron, you're absolutely right. It's different from one person to another. Some people do it in a few weeks, okay, 12, 15 weeks. But depends on your preparation. I would suggest at least 3 to 6 months in preparation, just to ensure that you have covered everything, you have done what you're supposed to do, you look at the previous cases, you've joined the academy, etc. It's different from one person to another. Some people, I mean, take PLAB 1, PLAB 2, finish everything within a year. Now, just to let you know, with PLAB 1, it's only held 4 times a year. So sometimes it's very difficult to find a place and you have to wait. For PLAB 2, it's almost every day of the year. I mean, between probably 15 and 20 times a month. So getting a place is not difficult when you pass PLAB 1 as far as you're prepared. So whenever you feel that you are ready, you book yourself, go through an academy or course with whoever you feel comfortable with, have hands-on the mannequins, practice, tips from examiners, preparing for IPS, communication skills, difficult scenarios, what other people did, experience from those who took the exam and didn't pass. And the best course ever is the exam itself. So those who were unfortunate to pass the first time, they become experts in the course and what is needed because they've been through it themselves. That 6 minutes alarm, you said, yes, I mean, you have 8 minutes, okay? You can finish in 8 minutes if you are very well organized. If you practice within 6 minutes, that means you can do it in 8 minutes very, very easily. Don't leave everything for the last 2 minutes. I've seen candidates struggling in the last 2 minutes. They keep taking history, and they're very good at taking histories, but they miss on the examination part, they miss on the management part, so they fail. Because remember, the domains will check for everything. If you miss one domain fully, completely, you can't pass. If you do bits and pieces in each domain, you can still pass, or at least you get a mark that can help you if you do better in one of the other stations. But if you miss a whole domain because of time, you can't pass. You're welcome. You're welcome, Aaron. The recording, I believe it has been recorded, and the technical team will deal with that. But yes, it has been recorded, and I think it will appear on the social media and on our website. I mean, there will be other webinars very, very soon. I mean, we'll try to do as many webinars as we can. First of all, to deal with the questions you might post to us or inquire in a later date, and also to give some sort of more, I mean, today was a general one, just to talk about the test in general, but we might pick up one or two scenarios here or there, not the full scenario, but at least what you need to look at, some sort of preparation for the actual exam in the coming days. Right. Anything else, guys? Thank you all for joining me and the team, and for giving your time and listening. Again, you can do it. You've done it before. You can do it. If someone has done it before you, they are not better than you. You can still do it yourself. Be confident. Okay. Prepare very well. Practice as much as you can. Be familiar with all the difficulties. Find your weaknesses, your own weaknesses. Deal with them. Fill the gaps. Okay, and join the course. Thank you very much, and I hope to see you very soon in the next webinar. Thank you very much. Have a nice night. Good night.